We continue to focus on the coronavirus pandemic here on Eyewitness News at 9. We're also focusing on your concerns and questions about the virus. Dr. David Schultz with Evansville Primary Care joins me again tonight to answer many of your questions. And Dr. Schultz, thanks so much for being with us again tonight. First off, the CDC said yesterday that antibody tests used to determine if people have been infected in the past with COVID-19 might be wrong up to half of the time. More and more people, as you know, are getting that test now. Is that news concerning or even disappointing to you?
Well, Brandon, it's not really a surprise about this. First of all, there's many different coronaviruses out there. And because of that, and because so many people have had the mild forms of coronavirus around the country, there's a lot of false positives out there. And that can give a person a sense of false security that they cannot get the virus because they've already had the virus in the past, when in reality they've just simply had the common cold. So what's very important for researchers to do moving forward is to find a test that has a low rate of false positives, but likewise a low rate of false negatives, and both can have some very dire consequences. So if we had to choose of those, we need to limit the number of false positives in this case.
How important are antibody tests in controlling the spread of COVID-19?
Well, Brandon, it gives us direction and where things are going, because if we see a large amount of population that have positive antibodies, it indicates that either they're immunized in the case of a vaccination, or it indicates certainly that they've had the virus already and have some degree of immunity. And so that would indicate that that area would be a much safer area for someone trying to avoid contracting the coronavirus.
Okay. There's also a new report out that says as businesses begin to reopen, cases of the virus are rising in 18 states. Was that expected to happen?
Really, Brandon, we're expecting that. First of all, with dropping down on some of the social barriers that we have been doing, it's allowing people to be around more people. And by that mere fact, you're going to see increased numbers of coronavirus. The other thing, though, that's a little bit misleading, Brandon, is that there's a lot more people being tested than ever before for coronavirus and COVID-19. And because of that, you're going to find more people who may be asymptomatic with coronavirus, but at the same time are still testing positive with the addition of additional tests.
Interesting. I wanted to ask you, in Springfield, Missouri, 2 hairstylists tested positive at a hair salon, possibly exposing at least 140 people. The health department there says that the stylists were showing symptoms of the virus while they were working. Now, does this underline what the CDC recommends, that if you have symptoms, to stay at home?
Brandon, it really does. We really need to continue to follow through with the advice given by the CDC and also by the health officers of our counties to remain socially distanced when we have certainly those symptoms of coronavirus. That would include the fever, that would include body aches, chills and sweats, cough, congestion, and malaise, as well as loss of sense of smell. The more symptoms a person has, the more likely they have coronavirus. And in those cases, they should not go to work. They should rather be tested and self-quarantine.
Well, several people were out and attended events over the Memorial Day weekend. If anyone did get infected with the virus over the holiday weekend, how long would it be before we know about that?
Well, Brandon, the average incubation is 4 to 14 days, and most people are actually showing and demonstrating symptoms around day 4 of the coronavirus. Certainly, we do know that it's up to 14 days, but again, the average is 4 to 6 days is when people present most of the time.
Okay. Well, a lot of businesses, as we said, are reopening now. If one employee of a business tests positive for COVID-19, should other employees at that business be worried? And would that be a situation where all the employees should be tested or not?
Well, Brandon, certainly it's something that we need to be worried about. And the question is, if they get tested, will they have enough virus in their system to show a positive test? And that's a question that's still really unanswered. What I would advise individuals to do, if they get exposed to someone in the workplace, the very first thing they should do is they should be monitored more carefully. They should try to seek testing for COVID-19. The third thing I would do is have zinc, vitamin C, and vitamin D as supplements. And those are helpful in trying to prevent one from getting coronavirus.
All right, a lot of good information again tonight. Dr. David Schultz with Evansville Primary Care, thank you so much for joining us tonight.